Patients are asking ChatGPT which urgent care to visit around midnight. The question is yours showing up? A patient wakes up at 11 p.m., fever of 103, possible ear infection on their kid. They don't open a browser and type in urgent care near me into Google anymore. Now they're asking ChatGPT, and then they ask Perplexity, or they get one of the AI generated answers and then they go. If your clinic isn't in that answer, you don't even exist to the patient. That's actually happening in urgent care search right now. And most clinics, and honestly most marketing agencies, have no idea. Hi, I'm Nathan Hawks. I'm the president of Arcane Marketing, and we work exclusively with healthcare practices, and we've spent the last 10 years building the kind of digital foundation that gets clinics found when patients actually need them. Today, I'm going to walk you through 4 things that your urgent care clinic needs to do right now to make sure you show up in both local search and in AI generated answers. Stay through to the end because tip 4 is the big one, the one that almost nobody talks about, and it's the one that's going to matter the most and move the needle in the next 12 months. Let's go. Your urgent care clinic is invisible in the search that happens before the search. Here's what I mean by 2 search world. Search 1 is what everyone knows. Urgent care near me. It's Google Maps, there's a local pack, the business listings. That search still works the old way, and your local SEO basics actually still matter. Google Business Profile, consistent contact info everywhere, reviews, proximity signals, that hasn't gone away. Search 2 is the one that most clinics are completely missing. It's the research that happens before the local search. Patients asking AI, what urgent care in Scottsdale has good reviews for sports injuries? Or should I go to urgent care or an ER for a possible fracture? Or which urgent care clinics in my area are actually good? That's 200 million people a week asking AI about their health, and 70% of those are conversations happening outside of clinic hours. So your patient is asking ChatGPT about their sick kid at midnight, and ChatGPT is either recommending you or they're recommending your competitor, or saying nothing at all. The clinics that win are the ones that are showing up in both searches. The ones that lose are the ones that are only optimized for just one. If you don't know whether your clinic shows up in AI searches, Arcane Marketing can tell you, because we do a free audit, and we'll show you exactly what the AI engines are seeing when they evaluate your clinic. Our link is right below the video, and all you have to do is reach out. Second, traditional SEO gets you found on Google, and GEO gets recommended by AI, and most urgent care clinics have 0 GEO presence right now. GEO stands for Generative Engine Optimization. It's the discipline of optimizing your content so that AI tools will cite your clinic, recommend your services, and surface your information in their answers. And here's the uncomfortable truth. It's not always the same as writing a blog post. GEO requires 4 specific things. Number 1, schema markup. Structured data in your website code that tells AI engines in machine-readable language exactly who you are, what you treat, where you are, and who your providers are. Medical clinic schema, medical procedure schema, FAQ page schema. Most urgent care websites have 0 of this. 0. Number 2, clinic authorship. Every condition page, every service page, every FAQ section on your site needs a named clinician attached to it. Name, credentials, and their role. An anonymous blog post about strep throat symptoms has 0 AI citation value. A page reviewed by Dr. Sarah Chen, MD, medical director, gets cited, and that's the actual difference. Number 3, symptom-based content. Build pages targeting the specific things that your patients type in and ask about. Flu testing, UTI treatment, maybe laceration care or x-rays, minor fractures, anything like that localized to your city. These pages capture patients who are already in the know of what they need and are one step from walking into your door. Number 4, authoritative citations. Link out to the CDC, the NIH, peer-reviewed sources. AI tools evaluate your content partly based on whether it connects to established trusted sources. It's like a credibility check. Pass it and you get recommended. You fail it and you don't. Google pulls AI overviews from urgent care's near me searches entirely. That means your map pack visibility is still one of the most important things that nobody's fixing. Here's the good news that I mentioned earlier. Google actually reversed course on AI overviews for local provider searches. As of December 2025, urgent care near me and similar types of searches like that return traditional local pack. No AI summaries, just real listings. That means that your Google Business Profile is still one of the highest leverage things that you can optimize. Now, here is what a fully optimized urgent care Google Business Profile looks like. Every field is completed: your description, your services, your insurance accepted, hours including holidays, photos of the interior and exterior of your office, and wait time integration, if your software will support it. Name, address, and phone number consistency. Your name, address, and phone number need to be character for character, identical everywhere. On your website, on Google, in Yelp, in Apple Maps, in Health Grades, WebMD. If it says Suite 200 and another one says STE.200, that's a signal conflict, and Google notices. Then your rankings suffer. Reviews. Urgent care practices with a 4.2 or more star averages and a consistent flow of recent reviews will outperform a local pack every single time. Reviews are not just reputation management any longer. They are part of your local SEO infrastructure. You need a system that prompts satisfied patients to leave a review within 24 hours of their visit. And here's one that most clinics will skip entirely: Google Posts. Regular posts on your Google Business Profile signal to Google that your profile is active and it's maintained. Clinics that post weekly will outperform clinics with identical listings but zero post activity. It takes a few minutes a week. If your Google Business Profile isn't fully built out and you don't have a review generation system, you're leaving your easiest local SEO wins on the table. Fourth, your marketing agency might be creating HIPAA violations right now, and they might not ever even know it. This is one that makes people really uncomfortable, and it's the most important thing that I'm going to say today. HIPAA doesn't just apply to your EHR system or your clinical staff. It also applies to your marketing workflows too. Here's the real scenario that leads to real violations. A clinic's marketing team exports a segment of appointment inquiry data to understand what conditions patients are mostly searching for. Then they paste that data into a public version of ChatGPT just so they can generate a few content ideas. That's reportable breach. No EHR was touched, no chat was opened, but they still potentially broke federal law. The ground rule is this: zero PHI in AI prompts, period. Any patient data, any appointment history, any contact information, any review that could identify a specific patient stays completely out of AI tools unless those tools have been specifically reviewed and approved for HIPAA compliance. Every piece of AI-assisted content that your team produces should go through a clinical review before it publishes, and any agency managing your content should be able to hand you a document that outlines their PHI handling policies. If they look at you blankly when you ask that question, I think there's your answer. At Arcane Marketing, HIPAA-compliant content workflows are not optional. They're our standard, because one violation isn't just a fine, it's also your reputation. If you want to know exactly where your urgent care clinic stands in both local search and AI-generated answers, well, we do a free audit at Arcane Marketing without any obligation. It's just clarity. arcanemarketing.com. The link is right below this video.